Good morning. I'm Johanna Derlega, publisher of The Hill. Welcome to this morning's briefing, Prioritizing Patients, a discussion on outcomes-based care. I'd like to thank our sponsor, the Value Collaborative, an initiative of America's biopharmaceutical companies, for making the event possible. Healthcare in the United States is transitioning from a volume-based to a value-based reimbursement structure. This morning, we will explore what steps stakeholders are taking to create a more value-driven healthcare system. Is there a role that policymakers can or should play to ensure that this approach improves outcomes, and what are the implications for patients? We will hear from congressional leaders, health industry representatives, and patient advocates about outcome-based care and how it's challenging the way healthcare is provided and received. Before we get started, just a few notes of housekeeping. In addition to those of you here in the room, we are live streaming on thehill.com. We ask that you keep your phones on silent, but we encourage you to join the conversation. And you can follow us on Twitter at The Hill Events, and you can comment using the hashtag #ValueForPatients. We're going to be taking questions throughout the program, and so keep a lookout for members of our team with handheld mics. Finally, there is a very short survey on your chairs. We'd love to get your feedback about our events so that we can continue to make them better and better. So let's dive right in. We begin this morning with Senator Bill Cassidy. He's been in the news lately for coining the healthcare term the Jimmy Kimmel test. But Senator Cassidy has been involved and been a leader on healthcare issues for a number of years now. He's a member of the Senate Health, Education, Labor, and Pensions Committee. He's also one of the few physicians in Congress and provides care for uninsured and underinsured patients in Louisiana's charity hospital system. Welcome, Senator. And joining him on stage is my colleague, the Hill's editor-in-chief, Bob Cusack. Bob, over to you.
Senator, thanks for doing this.
Hey, Bob.
Well, you're in the middle of the healthcare battle. What is the latest on the plan to repeal and replace the Affordable Care Act? When will we see bill text?
A couple things in that question.
Just a few.
I think the latest is that, for a variety of reasons, the individual market is deteriorating very rapidly. And even in states like Ohio, where premiums have been stable, you see insurance companies pulling out. Now, obviously, there's 11 states before President Trump took office in which, as the insurance commissioner from Tennessee said, we're in a death spiral. But arguably, since events since President Trump has taken office has accelerated that in some states. So when Kevin Brady, Ways and Means Chair on the House side, says we probably should reinstitute or appropriate the cost-sharing reduction payments to stabilize the market, I think right now there's a sense that, oh my gosh, this market's just going to melt away, and we have to kind of shore it up or else there'll be nothing left to replace. So I think that is part of it. In terms of bill text, within the next several weeks, I think bill text will be out there. And
you've called the House bill yesterday's news because now the Senate is crafting its own bill. The politics of the Senate, obviously you can't afford many defections, only 2 Republicans. If, as expected, no Democrats will back the bill. What are your chances of getting a bill out of the Senate this summer?
I would like to think good. The American people for 8 years have been voting for folks who have said they would repeal and replace the Affordable Care Act. And so President Trump won, and when President Trump won, he said, not only am I going to repeal and replace, but he kind of laid out how he would replace. He would continue coverage, care for those with pre-existing conditions, eliminate the Obamacare mandates, and lower premiums. Now he won on that. And if you look, people took him seriously. So I'd like to think that Republican senators will take that seriously, attempt to fulfill his campaign contract with the voter, and get something out in July even.
How different will the legislation be compared to the House-passed bill?
I think it'll be significantly different, if only because the facts on the ground have changed. Since they passed that bill, you just see an implosion of many more individual markets. So again, Kevin Brady is speaking about cost-sharing reduction payments being put back out there. And that would be a significant departure from the AHCA. So I think we will be significantly different.
You've talked on television of making sure that the Senate bill will pass the so-called Jimmy Kimmel test. Will it, and how will it?
So, and you know, shorthand, in case folks don't know what that refers to, the question is, if you're going to lower premiums, you can lower premiums by giving lousy coverage. You don't want that. You want coverage, you want premiums which are lower but associated with more credible coverage. Jimmy Kimmel, whose son on the day of birth was needing to have major heart surgery, would it cover such an event? And not only on that day, but the lifetime of events afterwards. So there's several ways you could do that. If you look, I saw some statistics yesterday from an actuary that in the individual market, 5% of the patients account for 58% of the expense. Now, think about that. 5% of patients account for 58% of expense. United sent me some statistics that 0.8% of patients account for 10% of the expense. 0.8 account for 10% of the expense. So if you do what Maine did as one example, the so-called invisible high-risk pool, which is kind of a reinsurance pool, but on a state basis, they significantly lowered their premiums just by taking, if you will, that 0.8 that accounts for 10% and assigning them to a reinsurance pool. There's dollars there to support that, and that would lower premiums for all, but you could still have credible coverage.
As far as we have a story this morning that some stakeholder groups are complaining about the process, that there hasn't been hearings, that there are no planned markups, claiming that this process is being done behind closed doors and it's not being transparent enough. Are we going to see more transparency? Do you see any hearings or markups, or is it going to go straight to the floor?
Floor.
Okay, well that's and now you will. The rules say you must have a CBO score for reconciliation, correct? So there will be a CBO score released before the bill hits the floor. Okay. Now who is leading this effort? I know it's collaboration. There's a task force, but who do you see as making the final decisions? Because when you get down, as you know, Senator, when you get down to the devil's in the details, and they're going to have some tough decisions going to be made. Who's making those final decisions? Is it Senator Hatch? Is it Senator Enzi? Is it Senator McConnell?
Well, to say it would be, say, Senator McConnell would suggest that no one else has input. But clearly McConnell is trying to get something which, frankly, he has 50 votes for, right? So, if you will, every senator has a role. Now, obviously, some animals are more equal than others. So, that said, the leader's office is the one kind of amalgamating this, but we all have input.
Okay. And what about the input of either outside groups, that could be healthcare groups, it could be groups on the right that like the House bill but are a little wary of where the Senate bill they think is heading. How much input are you taking from those type of outside groups?
Significant. For example, yesterday a group of senators and I met with actuaries and got a lot of good feedback as what works, what doesn't work. I know leadership is also hearing from such groups. So there is such input.
You've worked closely with Senator Susan Collins on this, a centrist. Is that the key, do you think, is making sure that the votes are there from the Senators Murkowski and Portman? And are you talking to any Democrats, even conservative Democrats, or do you think just the politics of this are impossible to get any Democrats?
Well, kind of working backwards, I've spoken to conservative and moderate and liberal Democrats. And so far, no Democrat wants to break ranks. So just to put a point on it. And I always say it's a little bit of a shame because reconciliation, people may complain about reconciliation, but that actually represents an opportunity. You don't need 8 or 12 Democrats to break ranks. You only need 2 or 3 or 1. And all of a sudden, that 1 or 2 or 3 becomes a deal former. But none wish to break ranks. And I understand there's incredible political pressure on their side. But nonetheless, as I point out, it's not just my state in which middle-class families are paying $20,000, $30,000, and $40,000 a year for their insurance premiums. It's your state too. And here's a bunch of alpha females and alpha males pledging to do everything they can for their constituents, and now they don't want to break ranks. If I sound a little bit kind of frustrated, at home I jump up and down. Now, in terms of the other part, you mentioned Susan Collins, Lisa Murkowski. They want to do what's right for their constituents. And Susan will point out that Maine is an older state, and if you are not careful, then folks will be priced out of their premiums merely because they're older. And then Lisa will point out that the cost of health care is the premiums are twice as high in Alaska as in the lower 48. And so you have to take into account the fact that the federal poverty level in Alaska is about 1.5 times of the lower 48, and insurance premiums are 2 times, I think I know that. And so she obviously is concerned about, is there adequate funding for her folks?
Some people are already pointing to Senator Ted Cruz as key. He has obviously some ties to House colleagues. Have you talked to Senator Cruz? Do you think that he will be on board? Because as I mentioned earlier, you can't afford many defections here.
You know, I'm not about to speak for Ted.
But getting the conservative wing is very, very important. And this is...
Now, I'm not sure how you're defining conservative, because I'm going to dispute that a little bit.
Okay.
I think that the Cassidy Collins plan is the conservative plan because, one, it's fiscally responsible. It pays for the promises that government has made. Secondly, it devolves power back to the states, 10th Amendment. So, Bob, I'm going to dispute a little bit the basis of your comment, because anybody that doesn't wish to devolve back to the states, who wishes to keep power in the federal government, as did Obamacare, I don't think is pursuing a conservative solution.
We recently reported that there's some issue that Republicans acknowledge with reconciliation and the so-called Hyde language. Is that an issue? What's the remedy here to that problem?
Well, the reconciliation means that you can't bring up policy which doesn't either raise or lower spending directly, not just tangentially. And Hyde, so reportedly, does not pass that test. It doesn't raise or lower.
Parliamentarian indicated that, yes.
Yes. So Republicans obviously are concerned that we continue the Hyde language. And if you create a new sort of credit, any limitation upon the use of that credit would be, we would like it to be subject to the Hyde language. And if the parliamentarian doesn't allow it, it does create a problem. Now, there's some workarounds, but any workaround is a workaround. So that's where we're.
So as far as the Planned Parenthood funding, that's something that Senator Collins has raised an issue with. Where do you see the Senate bill on defunding or not defunding?
Again, I don't know where the parliamentarian is going to say that she is on that. So I can't entirely comment on that. So I mean, I just don't know. That's going to be a parliamentarian call.
When do you see a vote happening? You mentioned text being released maybe over the next several weeks. Then that gets you pretty close to the July 4th recess. There's been a question of, will you vote on by July 4th, or is it more kind of the goal of voting before you adjourn in August?
I think both. I think the sooner the better from leadership's perspective, but obviously some things slide. It'll take 2 or 3, although there's an iterative process with CBO right now. It's not like we give them a package and we hear back. No, it's kind of a go back and forth.
Right.
Yeah. And then maybe meld everything together. So you could have that before the 4th, but you know, I think there's a real commitment to get it done before August.
I mean, this is an unusual process because, as you know, when bills die in the Senate, let's say climate change, when Democrats were in charge, they just didn't go to a vote. But this will go to a vote, do you think? Either way?
That's a leadership call, and I suspect they will. John Cornyn's a pretty good whip, and I think he'll know his vote count. So if they bring it to the floor, I suspect they know they have the votes.
The political pressure here, we saw this in the formation of the ACA, that every senator in the Democratic caucus was under enormous pressure to vote for it because they couldn't afford any defections. Do you see this as a vote similarly for the Republican Party, that if you don't vote for whatever you guys come up with, that, well, you're really stopping this bill. You're not, you just advance it because we can go into conference and have another crack at it?
I think that was the House calculus. As one person told me, he was told, just pass it, the Senate will fix.
And that didn't go over too well, at least not initially when they couldn't pass it.
Well, he voted for it.
Okay.
But to your question, when Obamacare was passed, there was a lot of, oh my gosh, I mean, this is the end of history. We've settled everything, by golly, it's going to be a wonderful future. And we've known that, at least in some states, that it's just not worked out to be the case. And we also know with the House plan, according to the CBO, premiums would increase 20% more than they would under the Affordable Care Act. So it isn't as quite, when the Democrats passed it, they could at least claim that it was going to usher in a new era. Now we can say we've seen that era, and it wasn't quite as rosy for everybody as it was said to be. And we have premiums now. One fellow in Baton Rouge I'm close to, he and his wife, their quote last year was $39,000 for their insurance premium. $39,000. So what you just said, yes, there'll be political pressure, but it actually cuts both ways. Are you going to vote for something that will raise a premium of $39,000 another 40%? Oh, well, this is crazy. I mean, no one can afford that. Or are you not going to vote to repeal Obamacare? So I think that there is kind of countervailing pressure. If you vote for something and next plan year premiums are up significantly, that was a bad vote. The president, remember, the president is very intuitive on the campaign trail, and he obviously would kind of get in sync with the voters. And when his pledge was to continue coverage, caring for pre-existing conditions, eliminating mandates, and lowering premiums, that resonated. And people expect that. And if you vote for something which doesn't accomplish that, I think there'll be disappointment among great swaths of Republican voters.
Well, Senator Lindsey Graham has suggested, well, if Republicans can't pass a bill, just let Obamacare fail, and then Democrats will come to the table. But while Democrats say they're interested in working on a bipartisan basis, they haven't proposed one unified fix to the Affordable Care Act. They do acknowledge there are problems there. Do you think that's what Senator Graham indicated is a strategy that could work if somehow you can't pass a bill?
Well, I don't know, but I will say, as I say to my Democratic colleagues, in your state, there's a middle-class family paying $20,000, $30,000, and $40,000 a year for premiums with $6,000 personal deductibles, $13,000 family deductibles. As one fellow who lives here in Washington, D.C. said, his family premium is $24,000. Their family deductible is $13,000. If they get in an accident, they will be out $37,000 before the insurance kicks in. And I tried to reassure him. I said, don't worry, your colonoscopy is for free. Now, I think if it deteriorates further than that, I would like to think Democrats come to the table. But again, I'm going to express once more my frustration. That's the facts on the ground now in Washington, D.C., where supposedly the Affordable Care Act is working in the individual exchange. And for that family, it is not. So I would hope it doesn't take a further deterioration to bring people on board to at least consider helping. I would hope they would come on now for the sake of those constituents as the gentleman I just mentioned.
We are going to take questions in a few minutes, so think of some, and then I'll go to the audience. When you think back to the formulation of the Affordable Care Act because of an election with Scott Brown, basically with a few exceptions, the House had to accept what the Senate had passed. Do you see history repeating itself, that if the Senate passes something, that you have to tell the House guys, well, you got to take mostly ours because otherwise we're not going to take your bill. Your bill can't pass the Senate. As a lot of people say, it wouldn't get 10 votes in the Senate.
I think that the facts on the ground have changed significantly since the House passed their bill. And I think, one, a lot of House members have heard from constituents how passionate they are, how fearful they are. In fact, I've mentioned this before. Jerry Moran, who's not a House member, but I think he speaks for many people, stood up in our luncheon once. And he goes, guys, I have to just tell you that Healthcare is an issue like no other. I go to my church, and the woman I've known from high school who's helped me in my campaigns all along comes up with tears rolling down her face, speaking of her mother's pre-existing condition and her fear that her mother's pre-existing condition will not be covered. Healthcare is an issue like no other. And I think what we've seen as members have gone back, House members have gone back to their district, they have found that good, strong Republicans are concerned about what's going to happen to their mother's pre-existing condition. Now that begins to shape someone's understanding. If you add that to the fact that premiums are going up, I just saw in Maryland, 59% one plan's increasing their premiums. So, and again, Iowa, out of their 99 counties, only 5 now still have an insurance company there. I think the facts changing since the AHCA, the American people expressing their fears to their elected representatives means that when the Senate passes a bill and sends it back over, I do think the House will be receptive. I can't speak for the House, but I can imagine they'll be receptive to that which we send back, because I think ours is kind of reflects that changed environment.
Mm-hmm. And you know a lot of the House guys having served there, and a lot of senators have served there. So why don't we go to questions? If you can identify yourself and then ask a question to the senator.
About 800% people with mental substances, many of them rely on Medicaid coverage for their care.
So if folks did not hear, concern was about Medicaid representing county health officials and specifically mental health, and references the $800 billion that the House cuts out of the Medicaid program. First, let me say I think there are savings in the Medicaid program. There's a blue state governor who called and said that a lot of employers are putting his or their employees upon Medicaid. Now, that's probably not what Medicaid was fashioned for, at least not to pick the full freight up for such employees. So how much he was cognizant of it and seemed to suggest there's a lot of money there that's being spent that doesn't have to be. So let's just say that there's savings. On the other hand, I hear exactly what you're saying. Rob Portman makes the point over and over again that 50% of the Medicaid expansion dollar in Ohio has gone to treat opioid addictions. There's been some thought of having a separate opioid fund and kind of supplementing. It depends on how much that fund would be, but in the 21st Century Cures bill, Chris Murphy and I had a big section about mental health reform, and one of our advances was to begin to integrate more completely mental health with physical health. So if a separate fund would bifurcate opioid addiction from physical health, I personally think that would be bad medicine. So not answering your question directly, because I can't answer it yet, we haven't seen legislative language, I will say that there are savings in Medicaid, but we have to recognize the role of the expansion specifically in opioid addiction, and I think that's a lot of the reason that folks are like Rob Portman and others have pushed to continue it. But let me mention one more thing about the Medicaid expansion. The kind of dirty little secret is that by 2020, states are going to be responsible for 10% of that spend, and states cannot afford that 10%. California's 10% will be $2.2 billion. And I don't see Sacramento having $2.2 billion laying around. Louisiana's is $310 million. So one of the things is that states cannot afford their 10%. And that's why I hope that Democrats will come to the table, because it isn't just like, oh, if we keep the Medicaid expansion, things are going to be good. No, we can say that both legislators in Oregon and Arkansas have proposed either eliminating or rolling back the expansion because Oregon and Arkansas cannot afford that 10%. So there is a need to reform this going forward.
Over here, we have a mic.
Good morning. I'm Tanya Kinlow with the Children's National Health System, the Children's Hospital here in the District of Columbia. And my question, too, is about Medicaid, but more specifically about the impact of the cuts on children. We fear that children are not being considered, and the long-term impact. We've had a study done by Avalier that says by 2026, $40 billion of cuts to kids in Medicaid. This is the safety net for our children, and I just am hoping that there is going to be some consideration for the impact that will happen to these vulnerable children.
As a physician who has worked in the public hospital system of Louisiana caring for the uninsured, I share your concerns.
One back there.
Roberta Stanley. You touched on briefly pre-existing conditions, but it seems as if the list has quite a tilt toward women, that if you've been pregnant, you actually have a vagina, you have a pre-existing condition. Would you address that, please?
I'm not quite sure I know what you're saying.
It's been, the pre-existing condition list is so long, but it tilts a certain way, and it seems to be more tilted against women because of our interesting body construction.
I'm just not.
I'll have to deal with you privately. Thank you.
Yeah, I don't quite follow. I'm a physician, so I don't mind discussing various parts of a person's body. You know, I mean, I have an interesting dinner conversation with my wife sometimes, but who's also a physician. But still, anyone else?
One question I have, just as this last question, this is such a crucial stretch, it seems, for the Republican Party, because Republicans are not known for moving health care legislation. John Boehner said Republicans never agree on health care legislation, though Republicans did pass a Medicare prescription drug bill in 2003 that has been, is popular and basically has worked. But how important is it for the party to get this right? Because you guys control everything right now.
I think it's very important. Ben Sass said something which I thought was pretty good. He goes, we have really three courses we could take. One, we don't repeal and replace. That would not be good. Two, we repeal but we replace badly. That would be equally bad. Or we repeal and replace well. Now, that's great for the American people. That's great for our economy. Things begin to move. If you want to speak of politics, good policy is good politics. And so in that case, I think, speaking as an American, our Congress would have done its responsibility to the American people. And in that case, it would be very important to our party, but more importantly, very important to our country.
Well, we will be watching very closely. Please thank the Senator.
Thank you.
Thank you, Senator.
Thanks, Bob.
Appreciate it. I'll hand it over to Johanna.
Thank you, Senator Cassidy. One note before I make my next intro, there are lots of chairs up here, so feel free to come on up if you'd like to, if you're more comfortable. Bob is staying back for our next interview. I'd now like to call on Congresswoman Doris Matsui, a senior member of the House Energy and Commerce Committee. Working through her committee, Congresswoman Matsui helped author the Affordable Care Act, and she advocates for access to high-quality health care services. Welcome, Congresswoman. Come on up.
Good to see you. First question is, the current system of healthcare, is it working for patients, and how should it be refined?
Well, thank you very much for having me here
Thank you
today,
for-
first of all. You know what? The current system is better than it was before. I will say that.
When pre-Affordable
Pre-ACA,
Care.
right,
Okay.
absolutely. And the Affordable Care Act really did change, I think, the trajectory of health care, because we really are looking now, when we authored it, we really looked at improving the quality and efficiency of care. And to do that, obviously, we had to make a lot of changes because, as you know, healthcare is complicated. And
Yes.
it's something where we couldn't do it overnight either. So that, for instance, everybody has to be all in. We felt very strongly about that. So that's why we had like, the individual
mandate, right.
Right. And we also felt that we had to look at this as a holistically, in the sense of it has to be not only, we have to emphasize the health part of it. It's not just sick care, it's health care. So a lot of it also involved prevention and chronic disease management, which we thought was really very, very important. And also including that too, we also looked at the fact that mental health had to be part of it too, because physical health and mental health are really entwined, and we believe they should not be separated out. So I believe that we made great steps And in the implementation process, we were even going to be doing more, which we had. But I must say that we have not had a whole lot of cooperation in doing some of these kinds of things. So I am still very hopeful. The Affordable Care Act was something that, when you think about it, was quite a step. I think it was Teddy Roosevelt who tried to pass health care 100 years ago, more. And it was not something that everybody overnight was going to say this is the greatest thing that happened. Because what we probably didn't explain that well was that as soon as the bill became law, there was still a transition implementation period.
Mm-hmm.
Yeah.
And I mean, just in the politics of it, is that where we've seen some of the politics and the polls change on the Affordable Care Act? And but was it a message issue because Obamacare was central to the House Republican effort to win back the House in 2010 and then the Senate in 2014? And now do you think the politics are changing because the House bill is not a popular bill, as Senator Cassidy was indicating, and now Republicans are the ones being confronted at their town hall meetings?
You're correct there. We were somewhat astounded at the level of energy around the town hall meetings. We had nothing to do with that. I think what happened essentially was that people who never had health care before finally got it and realized it was because of the Affordable Care Act. So they really came out in droves. And were very specific about their own health care. And that's a situation that I think people tend to forget until you have your own challenges. Health care is very personal. It affects everyone just where they are at the time. So whether it's cancer or whether it's heart disease, diabetes, it is your own particular concern. And I think when we saw the town hall meetings and we saw sometimes a fury, it was that. It was that sense of losing it.
Mm-hmm. And what do you think has changed that dynamic? Is that, I mean, a lot of people who have coverage on the Affordable Care Act voted for Donald Trump. States like West Virginia, for
yes,
example.
They did. I think that's part of not quite understanding what the Affordable Care Act has done. For instance, Medicaid expansion for low-income adults. A lot of people in those states really got the health care that they finally needed, mm-hmm. including mental health and opioid addictions. And I don't think they had quite the connection that it really was about the Affordable Care Act. And there are other things going on too, the economic situation and jobs. So that got all conflated, I believe.
Mm-hmm. As far as Democrats acknowledge, some states, the Affordable Care Act is working better than others, and that Democrats say they're willing to come to the table and work with Republicans. Why not propose some changes that could work? We haven't seen a unified proposal from the Democratic Party to say, let's fix 1, 2, and 3, and let's not do that House-passed bill or what the Republicans are working on in the Senate.
Well, first of all, I would love to work with Republicans to, in essence, to improve the Affordable Care Act. I don't believe we can just wholesale just toss it away. It's working. We need to improve it. It's what we need to do. And as long as the repeal, I guess, when you talk about repeal, that means getting rid of everything. Mm-hmm. We will all come to the table if we want to build upon the Affordable Care Act. There are pieces of it that I think they agree with, and I think we should build on that.
Where just the future of healthcare in general, the ACA moved to more of an incentivized program for providers. Mm-hmm. Where some Democrats like Bernie Sanders say we need to move to a Medicare for all single payer system, but where do tweaks have to be made, or major reforms in the healthcare system?
Well, I think that what we did with the Affordable Care Act is really look at access and try to improve the coverage. What we didn't do as good a job in is really the costs of health care. And I think we need to address that.
Like premiums?
Well, I'm really looking at the cost of hospitals and drugs and things like that. Mm-hmm. And I think there is an agreement that we need to kind of get together on that. I think the first thing we want to do is make sure that everybody had health care. Mm-hmm. If we look at the cost situation, we need to work on that. And also technology, too. We have not advanced as much as we need to in that regard, too.
Mm-hmm. Last year, you serve on the Energy and Commerce
Yes.
Committee, and there was some bipartisanship on the 21st Century Cures
Yes.
Act, which was really a rare moment, I thought, in healthcare politics. Is there anything going on in the Energy and Commerce Committee now that's bipartisan?
Well, we have worked on some smaller bills. I wouldn't say smaller bills in the sense that we had bipartisan agreement on the FDA bills that we had to have, you know. So
Right.
those were very important. And when we have sort of bills that we can all bring up, like we're very bipartisan on the hearing loss bill for children, and that's really very important. And I have worked with members of the committee on mental illness issues, so mental health issues. So there are ways that we have come together, not in the large package, but these discrete areas that we feel that we can move forward on.
As far as some of the problems that have been cited with the ACA right now are insurance options and choice of plans, as well as premiums. What are the solutions here? Because as you know, the Trump administration has indicated that at times they just may let it collapse. And then there's also an ongoing lawsuit between House Republicans and what had been the Obama administration, now the Trump administration, and that's still pending on subsidies. But what are the solutions to the problems that could be fixed within the next year or so?
Well, I believe right away, we need to stabilize insurance companies. That's what we need to do. So the cost sharing really must be continued. They need to be paid, in essence, because right now there's this feeling that, inconsistency. They don't know whether from one month to the next, whether it's going to be paid or not. And insurance companies are a business. They can't go on that way. So that's why they're threatening to raise the premiums, obviously, or even leave the system itself. Right away, if we do that, take care of the cost sharing, I think that would begin to stabilize that particular part of the insurance company.
When you go home and you're addressing constituents now, what are the top issues in healthcare that they're raising with you?
Probably pre-existing conditions, probably more than anything else. That has really hit a chord with a lot of people. And they, in essence, want to make sure that they are covered regardless of any kind of condition they had previously. And let's face it, even if you don't have a pre-existing condition now, you may have one later on. So it's, it's one of the, everybody understands that. And I really also believe, too, people have actually experienced the importance and the fact that mental health is really part of the system. And the fact that we've sort of lowered the stigma, and we're really encouraging people to get care at community health clinics. And in fact, I worked on the Excellence in Mental Health bill, which passed in part of another bill. And in essence, which really does incentivize have community health behavioral centers so that people can come to that before a problem arises to get a diagnosis or early intervention. And be able to contact a doctor too, a primary care doctor, so that the systems could actually be integrated in a way where the person himself feels like they're not looked at in a way that would prevent them from wanting to go to a place like that.
What is the mood in the House Democratic caucus? Obviously, a very devastating election in November 2016. And then there was, at one point, there was some concerns that possibly conservative Democrats in the Senate might work with Republicans on repealing the Affordable Care Act. That is not the case now. Every Democrat, as you know, I don't think it was a big whipping operation, voted against the Republican bill, which barely passed on the second time through. Every Democrat also recently voted against the Dodd-Frank revamp. So what is kind of the mood now? It must have been, tough last fall, but it seems like the party, certainly there are some fractures with the resurgent left and some issues on issues like abortion. But what is the mood in the House Democratic caucus now? It seems like you guys are pretty united.
Yes, we are. We are. The House Democratic caucus is very united. I mean, we might have some little differences, but as a whole, we are very united. We believe we did the right thing with the Affordable Care Act. There are a little bit differences. We know we can fix it. And we really do feel that this is the direction we would like to go. And we've actually not been invited, actually, to be a part of any type of rewriting any bill or anything like that. So, you know, I think all of us feel like we know who we are. We believe in the Affordable Care Act, and that's where we are.
Republicans say they're optimistic that they can pass something through the Senate. It was very difficult to get it through the House. But where do you see, do you think that they can get behind something and get the votes to, not only to pass it through the Senate, but then merge it with a House bill that Senator Cassie is acknowledging it's going to be extremely different than what passed the House, and polls show that House-passed bill was not popular. What do you? How do you read the tea leaves? Because this is going to be decided, it seems, this summer. If they don't get it passed this summer, they're moving on to tax reform in the fall.
Right. I honestly don't see how it can happen because you still have the same problem in the House as you did before. You've got so-called moderates trying to listen to their constituents, and you've got the Freedom Caucus that I don't believe will change their mind at all. So it's difficult for me to see. But I'm not a Republican, so I don't know. I mean, I'll leave it up to them.
Have you, without naming any names, talked to any Republican moderates? Because most of the defections came from moderates in the House, not conservatives, because the bill at the end moved more to the right, expressing some concern because those moderates a lot of them are vulnerable politically in the midterm election.
Those that voted, the moderates that voted against it, I mean, I know who they are, and I appreciate the way they voted. I think they voted with their constituents. I think the ones that might have difficulties are some of those who voted for the bill because many of them have huge numbers of, for instance, Medicaid participants.
Right.
And so I think it was difficult for them, but they voted for the bill anyway. So I can look at it either way. I think that they may have more difficulty than the moderates.
Just moving forward with health care in the future, if Republicans, as you suspect, don't get the votes to pass it, it's very hard for them to say, well, let's just move on to the next thing. And doesn't the politics of the ACA and the fight and the fierceness of it just kind of poison the well for any other type of big bills that could attract some bipartisan support, specifically on health care?
On health care, well, I think there's some movement as far as having the cost-sharing aspect of it with insurance companies. I think that would be a huge move if they would move in that direction. And I think that there is now a sense that we have that the Republicans feel that something needs to be done there. Because I don't think they want to see the whole thing collapse either. Because it really is on their watch then, instead of our watch.
Right.
And we just want it to happen so that, not the collapse, but we want the cost sharing to be paid off because in a sense, that will really begin to stabilize the insurance market. And you know, this is interesting too, that all of the emphasis on the Affordable Care Act, we get a lot. But what we fight about is a small piece of it. It's the market, right? And that's only like about 10% of the whole system.
Right.
Mostly everybody else is on employer health, right? And yet it's conflated so everybody believes the whole system is bad. But we're still just trying to fix the market. That's where we want to. That's where all the fights are about. And I find it interesting that a lot of people look at the Affordable Care Act and just think about that 10%.
Tom Price, a former colleague of yours, is now heading HHS. A lot of decisions are made administratively.
Right.
What have you seen so far in the administration of ACA by this new administration?
Well, we haven't seen too much yet, but pronouncements, we're not happy with them. But we're hopeful as we move along, we might be able to work with them. We, in the past, have worked with HHS a great deal. And I think we're going to have to figure out, I'm not even sure how we can communicate with them now because of various pronouncements that have come down from the administration. So we are trying to work that out.
What specifically are you referring
Well,
to?
I'm looking at, see, many times we have worked with CMS an awful lot on Medicare and all of that. But my understanding is that it might be more difficult to get our calls answered.
We'll also be taking questions in a couple of minutes for the Congresswoman. But as far as you talked about Republicans kind of owning the healthcare system. They control the House, Senate, and the White House. Do you think the strategy that Republicans have said, well, we can't pass the bill, we'll just let the system collapse, and then Democrats will come to the table? If that's the case, will Democrats come to the table?
I don't think they'll let the system collapse. I think there is a sense amongst, maybe not a majority, not getting there maybe, that they cannot let the system collapse at all. I mean, I think that would be devastating. And I think at that point, they'll probably come over and sort of maybe figure out how we might begin to start working together. You know, there's a lot of other things going on too. I mean, they're trying to do health reform too. And I don't know whether they could do tax reform, unless they do health care. Right. Because they want to get $800 billion, right. So in order to do something, I think they're going to have to look at the whole picture. And, you know, everybody says this, and I've said this all the time, why didn't we start with transportation first? We could have built a bipartisan type of coalition there.
And do you think that because they started with health care, that's going to make transportation that much more difficult because the beginning of the administration is so important to set the tone with Congress? Well,
I'm really surprised that there hasn't been much progress made on any front at all. I mean, it's usually this is the honeymoon period, right?
Right.
Has been. And it's not worked at all.
Right. We'll go to audience questions. If you have a question, please identify yourself. And we have microphones there to my left.
Thank you so much, and thank you so much for your honesty about, you know, how the Democrats even view the current ACA. I want to follow up on Bob's question in terms of why aren't the Democrats they acknowledge that there needs to be some fixes. Why not just be even more forthcoming about exactly what kinds of fixes you would like to work on and sort of make that public and sort of gain some public support on those things? And then related to that, how do you view competition in terms of healthcare, using some more market forces and putting competitive tools in the patient's hands in terms of fixes? Thank you.
Thank you very much for the question. And first of all, I think there are things we'd like to do, and it does take cooperation to do that too. So I would look upon things like, other than, you know, stabilizing the insurance markets, get beyond that, but also looking at some of the cost savings that we could do. I mean, prescription drugs come up all the time, and I'm not saying it's one, you know, entity or another. I think we need to come together there and try to figure that out, because so many people now use prescription drugs, and we are at a place now where we've got to look at generics and try to get them advanced faster and everything else. I think we would like to look at that. Technology, you know, that hasn't worked out that well. I mean, through the Recovery Act, we had the health IT, and, you know, that was everybody's, you know, electronic health records are so important. And everybody went out and tried to do it, and they're not interoperable or anything like that. So we are trying to encourage now, and we did it in the 21st Century Cures, to really look at the vendors and the providers and try to get them to come to some place where they can, where the software can be developed and all of that, so they can proceed on that. Because that is really important, you know, just in a sense of telemedicine itself, being able to use the data collection and actually be able to look at a person, that, you know, the patient-centered care, to find out what other things are wrong too, and being able to communicate. Those are the kinds of things that I think are doable, and I think there could be things that we do talk about that a lot, and we do have bills in that direction that we can just add to it. And I like that, those kinds of things to be part of what we'd like to do to improve the Affordable Care Act.
Any other questions from the audience? Right here in the front.
Thank you very much for your support of mental health. And another mental health question. One of the proposals that we hear about is making the essential health benefit optional. If if the essential health benefit is made optional, then the parity legislation, which was passed in 2008, in effect, no longer has any effect because it's contingent upon having the essential health benefit. Can you comment on that?
Well, I believe we have to have the essential health benefits. I mean, really clearly. I mean, it covers not only mental health and opioid addiction, hospitalization, maternity, prescription drugs, and it really is something where every health plan has to have that. And part of the problem, obviously, with the House bill is that, you know, sending out to the states, they could decide what piece of it they want. And that is unfortunate because we've made a lot of progress. And that's one of the areas where women don't have to worry about, you know, maternity, health. I mean, I think men have something to do with that too. So I really feel like that was one of the, I think one of the most important things that we've done to be able to do that. So, yeah.
Any other questions from the audience? Okay. Well, please thank the Congresswoman. Really appreciate
Thank you.
coming in.
Appreciate it very much. Appreciate it. Thank you. Thanks a lot. Yeah.